So as you know, we are going to talk about COVID-19 and parents' concern. I'm a methodology expert, and what I do is I help students to work on their research and within educational psychology. So my field is in educational psychology. And also I'm here with my wife, Monique, Dr. Monique Edu. She's a pediatrician. She's going to give you COVID-19 from the perspective of medicine, right? And then after that, I will also give you information about this issue from the perspective of psychology, right? Psychological issues related to this. So I will hand over the presentation to my wife, Dr. Monica Du, to talk about COVID-19 and parents' concern.
Okay, thank you, Philip. So, as Philip said, basically tonight we want to make sure that everyone leaves with a little bit more information regarding COVID-19 and how we can manage it currently as parents, as just human beings in this world that, we have all been tossed into this situation that none of us could have been prepared for. And we're just learning and trying each day to do the best we can. But the more informed we are is the better prepared we can be and the better able we are to make good decisions for ourselves and our families. So the first slide is pretty much going into an introduction about what COVID-19 is. It's also called coronavirus or SARS-CoV-2. The coronavirus is basically, as it says, a virus that causes most frequently a severe pneumonia in infected persons, and sometimes so severe, of course, you've seen many people hospitalized, it can lead to chronic medical issues or even death. And that's what most of us are afraid of. That's what we're seeing on the news. But it can also range from mild symptoms to actually no symptoms at all. Some people are called asymptomatic carriers, which means that they are actually positive, but they don't show any symptoms. And this is where it's a little bit challenging because we don't have all the numbers for those people that are asymptomatic. And if they go out into our communities and, share spaces with us, they can potentially infect many people and they don't even know it. The incubation period of the illness is normally about 14 days to 2 weeks from the time that you're exposed. And people can actually have symptoms on average from 4 to 5 days or as even low as within 2 days. So some people feel sick pretty quickly and some actually feel just fine. And then over the course of a week or more, they start to feel sick. So you might be wondering, what kind of symptoms are, people coming in with? Most of the time it's respiratory. So they're going to have like a really bad cough, chest pain, difficulty breathing. Of course, they can have fevers, body aches. And even now, new research has shown that people are having issues actually with their sense of taste and smell. Other areas that can be affected are the GI tract as well, and some people have diarrhea. And then in severe cases, which is the most concerning, people can actually have multiple organ system involvement involving their brain. That's why you hear sometimes people say a patient had a stroke, their kidneys. Some people actually get placed on dialysis, the skin, and then as I mentioned, the stomach. In rare cases, which most of us, might be concerned about as we're focusing on the family, children can have a severe systemic inflammatory syndrome, and they present normally looking really, really sick. They have very high fever that's not going down, and then they have really interesting rash on their body, skin peeling, just look really red and swollen. So if you see something like that in your child, or you hear a relative or a friend saying that the child doesn't look well, they have this bad rash, they have a high fever, and this is with or without respiratory symptoms, then you need to call your doctor immediately because it can lead to fatality. But most of the time in children, you don't see that, but it's just important to mention because if it happens, you need to act quickly. most of the patients that are affected are actually those that are having underlying health conditions, like somebody with high blood pressure. They have maybe asthma. They have chronic obstructive pulmonary disease or COPD. They have some type of immune disorder, maybe like lupus, where they can't handle an infection regularly. And then if they get infected, it's even more of a blow to their system. And even people within a pro-inflammatory state, which means that they have increased inflammatory markers in their body at baseline. For example, somebody that's overweight or really obese, they are already at a more inflammatory state. They have a lot of chemicals in their body that are very highly reactive already. So if they get sick, it's even worse for them or more difficult for them to get through. So, many of us want to know like how many people are being affected. So this is a good website that you can look at. I've been kind of tracking the cases over time since it started several months ago. And this is the Johns Hopkins website. So if you look, you can see globally over 8 million cases, quite marked. In the US, over 2 million cases. And then in terms of fatalities or deaths globally, over 465,000 people. So it's a lot. And then if you look at the lower edge of this graphic, you can see that the rate of increase of infection has been just continuously on an upslope. So it looks like it's not going down. And I'm sure you've all heard in the news that cases are spiking. So right now people wonder if this is the same, illness that we've been dealing with from the beginning, or is this like a second wave of the same? Most people are saying that this is the same wave, the first wave that we were facing, same illness, and it's just that with reopening and more people gathering together, less social distancing, it looks to be that this is why the cases are increasing. So the main way that you can get this illness is basically from close contact with somebody that has it through respiratory droplets. So that means if somebody is coughing around you, they are releasing saliva and particles that carry the illness. So like going out into large crowds, like a party setting where you have many people gathered together, meetings, workplaces where you're next to somebody for long periods of time, the virus is carried in this situation more so than others. So basically the main way of transmission is through respiratory droplet. And you would likely be in the midst of someone for a while, as the slide shows, you have to have enough virus that makes itself over to you, building up around you, and then over time triggering an infection as the viral particles get inhaled and then go down into your lungs. Interestingly, lots of research has been happening since all this started, and they have found that there is a certain receptor on our cells, mainly found on our lung cells. It's called ACE. Okay. So the virus is going to enter the cell through this receptor called ACE. And it's interesting because, like I said, they're mainly found in the respiratory tissue, the respiratory system, but it's also found on the kidneys, the lungs, like I said, the brain, other areas, blood vessels. And this could maybe be why we have organ system involvement, because it can enter other areas of the body. But mainly it's more attracted to the lungs because of the load of receptors there.
That's one.
So this is just also a graphic of the multiple areas that are involved. Most of the time you always hear about the lungs, but as you can see from here, heart and blood vessels, brain, the eyes, the nose, the liver, kidneys, and the GI system or the intestines can be affected.
That's one.
So what do we do? This is a lot for us to deal with and hear. So some people are curious, how do you treat this? You hear a lot in the news. You hear about all these medications that people are trying. So, it's a virus. So there's no specific antibiotic that will help it, because antibiotics are normally given for bacterial infections. So the mainstay of treatment is supportive care. That's why you hear all about these respirators that people are on. They have to be ventilated because they're in such severe condition. This is one of the best things that we can do to help their lungs function better because it can't on its own. But in terms of medications, they have tried different things. One is an antiviral called remdesivir. And then you've heard, I'm sure, hydroxychloroquine, which you hear about all the time. Azithromycin is an antibiotic. But the thing is that it hasn't been studied long enough and well enough for us to know how it really produces its effect. But from the research that we have seen, it's actually not that great. As of this week, though, they came out with a new trial for dexamethasone, which is a steroid that's normally used for other conditions. And they found it to be actually pretty helpful, especially for those that are hospitalized. So when you hear about the medications, it's more so for people that are severely ill, not just somebody that may have like a little cough from it. You wouldn't want to give these medications like that also because they have side effects. So, you know, when you hear about all these medications being tried and people are taking it prophylactically or to take it to prevent illness, they have to be careful because it's not well studied, and it's all mostly for emergency care, for like a last resort, so that people can have some type of, you know, treatment to hopefully pull them through. So it's not recommended, you know, to ask a doctor, you know, for like preventive azithromycin or any of these because they have side effects, and you would need monitoring, and that's why it's given usually in the hospital. So you have to be careful when you hear in the news that people are just taking things. And as you have seen too, people have taken the wrong things and they end up either really, really sick or they have passed away. So it's really, you know, serious and important to know what is true and what's not true.
That's right.
So something else, you know, that we are also facing is the fact that there is a large disproportionate population of people that are suffering, and it's the minorities, Black people, African Americans, Hispanics. For, you know, particular reasons, they're being affected more than others. And this is because of the fact that outside of the COVID-19, usually we don't have the best health care, or we have chronic medical conditions that put us more at risk. So when this virus came around, it just exposed it more. So it exposed all these holes in the healthcare system, especially for the minorities, you know, Black people and so forth, as I said. Other factors can be lack of access to care. Some people just don't have a doctor or they can't get there. There's distancing issues. Many minorities also have certain jobs that, you know, kind of force them to go back because they have to put food on their table. And that means potential exposure because they might be in a crowded condition, certain things like that. And then living conditions. Quite a few of the population of Black people live in highly populated areas or densely populated areas, and then they don't have proper access to hospitals or other facilities that would be, you know, an assistance to them. So it's just all kind of like a spiraling effect, and then you have all of these cases more so in the, you know, minority population.
That's right.
So on at least a little bit of a good note, the illness seems to be less severe in children, which is great news. You know, you don't normally hear too much about children being affected. There are a few, you know, any disease can cause a problem in anybody, but for this population, for children, it's they're more to be not as affected, and then most of them don't even get it. Thank goodness, thank God. So most healthy children without chronic medical problems won't get it, or if they're positive, they don't normally have severe presentations. But as I had mentioned earlier, they can have that multi-system inflammatory disorder. So that's, you know, important to keep in mind. So like I said, if you see it or if you're suspicious of it, high fever, skin issues, things like that, that's a rare presentation and they can have it. But thank goodness, normally the population of children that are affected are very low, very, very low. And then also those that may be positive, they don't seem to be what they call like super spreaders, meaning that they don't seem to be carrying infection and passing it along as much as more so like adults and young adults. So that's also good news. And I just wanted to just give you a little bit of numbers here so that you could see what I'm saying about the children. So according to the CDC, among 150,000 cases that they looked at from February 12th to April 2nd, only 2,500 or 1.7%, which is really low, were in children. So that is, you know, very good numbers, you know. So looks like this was also found to be in China and Italy when they reviewed cases. It's unlikely to be in children. It's not as high. It's more so in the adults and those with the chronic conditions, those that are at higher risk, but not the children, unless they have something that's making them, you know, more susceptible. So what is it that we can do? This, you know, a lot of things happening and sometimes we just don't know, but at least there are a few things that we can do to at least try to keep ourselves as safe as possible. So in general, even without COVID-19 and this pandemic, we have to keep ourselves healthy at baseline so that if ever we are encountering an illness like this, we can have like a fighting chance because our body is healthy and we're well equipped. Make sure we wash our hands for at least 20 seconds with soap and water. Or if you don't have soap and water, then you can do a hand sanitizer that has at least 60 to 70% of alcohol content. And of course, you always hear avoid touching your face, your eyes, and the mouth because those are potential entry routes. And then, of course, wearing the face mask is important. I know you don't see everybody doing it, but it has shown, studies have shown that those that are wearing the face mask are less likely to spread it. And then of course you have a little extra covering, so at least you're a little bit better protected, especially if you're going out into a crowd or in a place where you can't basically socially distance yourself, like in a grocery store, or some people are going to restaurants and so forth. And other places where there's just a lot of people, it's important to have the mask on. And then if we can, it's best honestly to try to avoid the large group gatherings. If you don't have to do like the parties and the things like that, it's best to avoid it, especially now when there are spikes in cases. It's safer to just avoid. And most importantly, you know, we don't hear about it as much, but I think it's important to remain spiritually alert and strong, you know, keep our minds in the Word of God. God knows all of this even before it has happened. He's in control, he's our guide, and he's promised to take care of us. So in all these things you hear, all these things that can make you nervous and stressed out and anxious, it's important to remember that God is above it all and he knows everything and he will provide for us. One of my favorite verses is, "But even the very hairs of your head are all numbered. Fear not therefore, because ye are more value than many sparrows." And that's Luke 12:7. So now Philip is going to go into some of the stressors that can occur from this pandemic. So I'm going to go ahead and let him begin.
Okay, thank you, Monique, for this presentation. As you heard, I'm going to talk about stresses related to COVID-19. And what are stresses? So stresses are events, situations, or perceived information that may adversely affect your quality of life. It may affect your physical health or your mental health. So it's always important for you to be aware of the stresses of life. So some of the stresses will be loss of job, loss of income, or inability to pay bills. And as you know of this pandemic, you know, in February 2020, the unemployment rate was 3.8%, but now it's 13%, and about 20.5 million Americans are unemployed. So this means that it's really affecting a lot of families, and then we have to be aware of those stresses that come. So some of the also stresses will be the homeschooling. Sometimes what happens is that because you are not used to supervising your child in terms of education, is an additional responsibility for you, and you have other responsibilities, job and work, and work from at home and other things, and also in addition, supervising a child to learn is a very stressful situation, and sometimes it made us appreciate what the teachers are doing in taking care of your child in terms of education. And sometimes you are worried about being infected. You listen to the news. Sometimes you realize the numbers keeps on going, and maybe some of your states, the numbers are going up. In Florida, the numbers are going very up, and then we just have to. You'll be worried, going outside, going to the grocery store, receiving packages. All these things can also adversely affect your quality of life because you are worried about it. And the lockdown restrictions, and because of that, maybe you are not going outside, going to outside and have socialize with people, going to church. All these things have been restricted, and this can also affect your quality of life. And racial injustice, you can see on Facebook and in the news how people that you can identify yourself with, seeing all these things, you can sometimes ask yourself, am I next, right? How will I react when I go outside? But how should I behave? And all these things can adversely affect your quality of life. So what do these stressors do to you? So it causes you sometimes to be anxious. You are worried about things that may not happen, but you just worry about it. And it can really have physical changes in you. It can increase your blood pressure. And it can also cause depression. You'll be depressed. You can loss of interest. You feeling sad. And you can be burnt out emotionally, mentally, and physically. You'll be burnt out. So it's very important for you to be aware of all these implications or effects, so that when it comes, you know what to do. So all these things, we have mild experience and we have acute or severe experience. When you realize that you are experiencing these ones and they are adversely affecting your day-to-day behavior or day-to-day activities, then you have to do something about it. You have to go and see mental health professional, or you have to see a psychologist to help you. The same way that every maybe 3 months you have to change oil of your car. Sometimes psychologically too, you have to seek help. And we shouldn't be hesitant to seek help. The same way that you seek physical help, and when you have issues. So how do you deal with all these stresses? So these stresses, some of them can be eradicated, some of them cannot be eradicated, but you can manage them, right? So first thing that you have to think about, you have to be hopeful. Thinking positive will help you. It will cause you to put all your energy on positive things. And the Bible always says that, whatever is good, or whatever is righteous, whatever is right, think about these things, right? You have to think positive, because if you allow the negative thought to consume you, you will be in trouble, right? In terms of psychology. And then it will not only affect you, but it affects your family, because sometimes when you are angry about something, you are anxious about something, indirectly you transfer that, that anxiety to people that you are close to. And sometimes you may be verbally abusive, not because you wanted to do that, because of your own stress that comes to you. So you have to be hopeful and think about good stuff, right? And you have to be aware of your emotions, right? And you have to know that if your emotions are changing, you have to always do self-reflection, because if you don't do that, you cause psychological harm to people you are close to, right? So it's always good to reflect and then think about yourself. What is the cause of my anger? What can I do about it, right? And also you have to engage in meditation, maybe self-reflection and prayer. All these activities will be very good for you. You know, prayer is, you know, telling the Lord your problems, and, you know, even just narrating or telling somebody that is the ultimate being, right, about your issue, you know, reduce stress and also help you to cope with the situation that you find yourself in. And you have to also share, you can also share your concern with people you trust. You have to exercise, you know, always exercise. It helps you reduce your stress. It helps you to be healthy. And the next one is you have to seek help. I always emphasize on seeking help because we are not used to doing that. I always say that we have to be proactive. Think about your situation. You've seen that there's a lot of people are losing their job. Always think about, what if I lose my job? What am I going to do? Right? What are the steps? Right? So planning ahead will help you a lot, especially when it comes to your finances. This is a very good time to save a lot so that in case you lose your job, you have something to rely on. And then in case you lose your job, you have to know the step that you have to take. Know in case like you have to file for unemployment benefit. You have to know it before you lose your job. Not like you lose your job now. You're the, what website should I go? What can I do? You have to be proactive. Plan ahead. And I always say that if you don't plan your life, the situation will plan for you, right? Always plan your physical health. Check. Go and do some physical check and see whether everything is functioning right. Psychological health, with self-reflection. You know, think about your things that give you a lot of stress and find out ways that you can improve upon it. You know, there are a lot of materials online that you can read to, you know, help you psychologically. Your finances is very important. And when it comes to finances, we have to, I always tell people, save, 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 because you don't know what will happen in the future. Another thing that you have to think about is you have to have multiple sources of income, right? Don't only depend on one way of having of income, because what if you lose your job? What if they fire you right now? What are you gonna do, right? At least have a side job in case of anything you can rely on. So these are, you know, what we have for you.